Hi, this is
Hi,
Janet
Janet.
Borland, and I am the director of the Association for Nahara. I am so excited to have Kyle Johnson with us. He is the Vice President of Sales for ClearScript. Kyle is responsible for management prospective client relationships. He has been instrumental in driving and designing innovative programs for clients such as ClearScript's 340B program and TribalRx Solutions, Accountable Care Organization ACO development, and captive arrangements. Kyle has been at ClearScript for 17 years and active in the employee benefits arena for 24 years. Throughout his career, Kyle has focused on pharmacy benefits management, PBM services, and third-party administration. He is regarded as an expert in the High Deductible Health Plan, HDHP, and Health Savings Account, the HSA arena. He is a featured speaker at state and national PBM conferences discussing marketplace and transparency, and a sought after speaker and contributor in the tribal nation space. Kyle holds a Bachelor of the Arts degree from Luther College and is also a licensed health and life agent. We're so excited to have Kyle with us today, and we're super excited that ClearScript is a 2024-2025 sponsor at our annual conference this coming September. Today's topic is what tribal groups need to know about the Big Three PBMs. And we have Kyle here with us from ClearScript, and I am going to ask Kyle some of the questions. And we're so lucky to be able to spend some time with you. Thank you, Kyle, for joining us today.
You are welcome, Janet. And I just, yeah, it's in listening to my bio being read, I think I've just entered my 25th year in my career.
Congratulations.
I know,
Mhm.
can you believe it? A quarter century. Um, almost, almost my entire career, I have been working in some capacity with tribal nation benefit plans. And so even prior to ClearScript, we had a little focus on TPA or third party administrator on the medical side, administering those benefits for tribal populations as well. So it's been definitely been a passion of mine that I've invested almost a quarter of a century into.
Fantastic. Well, thank you so much for doing everything that you do and
You
helping and
bet.
assisting tribal nations. Appreciate you.
You bet.
So, I have a question, and could you help me understand and or give us an idea of what a PBM is and what
Yes.
a PBM does?
Yes, great question. We live in a very acronym heavy industry, with PBM and HSAs and HRAs and TPAs and FSAs and WAC and MAC and AWP. I mean, in my bio, you just kind of dipped into a few of those, but it's. I just want to start by saying it's a very healthcare is very complex and it's very complicated. We live in this acronym based world, so please stop me if I need to explain something. I really would love to have this interaction be, as many layman terms as possible to try to boil this down to making it easy to understand. So at a very easy to understand high level, PBM is pharmacy benefit manager, and a PBM is in philosophically is created to, yes, help manage clinical effectiveness and appropriateness for members. I mean, in the end, we want members to be healthy. We want them to be happy, and that's just not just tribal populations, but non-tribal segment as well. We want members to get the right medication for the right condition, and make them, not only productive for their employer plans, but we want them to be happy and healthy. A PBM also is philosophically the intent was to be created to help a benefit plan drive down prescription costs. So yes, we have to make members healthy and happy and productive. We also have to do it at the most affordable cost point possible. So a PBM is the organization or the entity that employer plans hire to help set up network. What pharmacies can a member go to at what copays, what out of pocket, what are the discounts, like that the PBM's driving with those pharmacies? What's, set up a formulary or a preferred drug list. What drugs can a member get at what price point, and is really established to help an employer manage that portion of their healthcare bucket, which is a lot higher now than it was when I started in this industry. Drugs represented maybe 5 or 6 cents of the dollar, maybe 7 or 8 on the high end, and now it's 25, approaching 30% of the healthcare dollar is pharmacy related, and the
Mm-hmm.
costs just keep going up. So in philosophically speaking, we're created as an entity that's going to help a member, help an employer, um, help their members, but also help better manage their cost.
So when we talk about PBMs, is it something that, a lot of us have brokers that we work with, and
Sure.
they oversee our plans with our organization. Is a PBM something that we should talk to our brokers about and say, hey, can you help us facilitate a PBM?
Yes. So yes, short answer is yes. So employer groups, tribal
Mm-hmm.
nation, for your benefit plan, that could be for the government plan within, a tribal nation. It could also be for their enterprise folks, the
Mm-hmm.
casino, gaming, or any other enterprise that's under that umbrella. Um, Very frequently, those organizations will have a broker or a consultant, or sometimes both. And a consultant, the difference that I see is consultants will oftentimes are hired more from a project basis, like running an RFP, a request
Gotcha.
for proposal, or a request for
Mm-hmm.
information. And then usually it gets established with whomever the winning vendor is, and then the consultants are gone. Broker usually brokers a product or products and
Mm-hmm.
is connected heavily to that client. So yes, the brokers are the entities that are oftentimes engaged by human resources or financial
Right.
folks within a benefit plan to
Mm-hmm.
go out and vet PBMs. There are
Got it.
100 PBMs out there, and we're going to
Okay.
talk about, largely the big three and the history of where we've come from and where we're going. But
Absolutely.
there's a lot of PBMs, and so it can be
Fantastic.
very daunting. So a broker is oftentimes that source that a
Mhm.
client goes to help vet and place a PBM.
Excellent. Well, in your expertise, can you help us on what does the PBM landscape currently look like?
Oh yeah, great question. So as I said, there's over 100 PBMs. Um, However, and this is what the main topic of the discussion today, the market is dominated by the big three PBMs, and the big three PBMs are Express Scripts, CVS Caremark, and Optum. Not in that particular order in terms of size,
Hmm.
but those PBMs, it's a hard number to get. If somebody says how many lives are covered, it's a hard number to get your hands around, because if you added up all of the lives that PBMs say they have, it's actually more than the population in the continental U.S. So it's kind of a moving target. But generally, the big three you'll hear they have mid 80s to high 80s. I've heard even the low 90% of the market is actually with the big three, either directly or indirectly, because there are a lot of smaller PBMs that use the big three for their backroom or use the big three for their network, or rebate aggregation, claims technology, etc. So the big three does dominate the market and really impacts the landscape, to your question.
Excellent. So we are really excited that ClearScript is a Nahara sponsor.
Yep.
And we've been showcasing you on our website. We've been showcasing you on social media. But can you tell us about ClearScript? What is the origin story?
Yeah. Yeah, I love that term origin story, right? It's like now I should pull my shirt open. There's a Superman logo. Um, yeah, we don't want that. No, so our origin story, we started ClearScript. We started looking at starting ClearScript in around 2004. So um, so that's 20 years ago. We actually launched it in 2005. So we're coming on our 20th anniversary. Um,
Wow,
yep, next,
congratulations.
thank you. Next year, March specifically. But our origin story is we are a wholly owned business unit of Fairview Health System and Fairview Pharmacy Services. Fairview is our parent company is a large nonprofit health system in the Minneapolis Twin Cities area. So Minneapolis, St. Paul area of Minnesota. And, $5+ billion nonprofit health system. Pharmacy is extremely important within our care delivery model. So we have retail pharmacies, compounding, home infusion, specialty pharmacy, mail order pharmacy. We've been engaged in 340B since that program was created in 1992. So we are what is called a disproportionate share health system facilities, as well as critical access hospitals and other facilities that allow us to buy some prescriptions at a 340B rate. And we help obviously other organizations, including specifically 638 clinics within tribal populations, access that pricing as well.
Uh-huh.
But in 2004, Janet, we were looking at what we were paying as a self-funded employer, right? So we have had over close to 30,000 lives on our own benefit plan, and a large number of our prescriptions, close to 80%, were going to one of our own pharmacy, and we were with one of the big three PBMs at that time.
Hmm.
And there was a lot of money that just we couldn't account for it. We were paying more than what we were taking in on those prescriptions, and that is pretty standard practice in our market. It's called spread pricing or differential pricing, differential margin. It's essentially PBM has one contract with the pharmacy, one contract with the benefit plan who's paying the bill, and those contracts differ, and the amount that a plan is charged is different than what's paid to the pharmacy, and the PBM keeps the difference. So it was in the millions of dollars we were
Hmm.
overpaying, and so we felt, what, we can do something for ourselves, create a better mousetrap for our own organization, our own members, our own patients, and we created ClearScript and immediately saved our parent millions of dollars a year. And then we deployed it to the market. So we started out small in the Minnesota market. We went into the 5-state, the North and South Dakota, Iowa, Wisconsin, and Minnesota markets. And now, fast forward to where we're at now, we're processing claims on members in all 50 states. We're licensed as a TP and PBM, approaching all 50 states, but we're very strategic in who we market to. We call on a lot of hospitals and health system clients. Second to that, tribal nations. So we've turned the tribal nation market into our second largest book of business within our organization in terms
Hmm.
of numbers of contracts, and not necessarily membership, because a lot of these hospitals are extremely large, but in terms of number of clients, it's a big part of our business, and we absolutely love working with tribal nations. So our origin story is, we started this for ourselves, firing one of the big three, created something, took it to market. It's really been well received by certain market segments, including
Mhm.
tribal nations, and here we are today.
Wonderful. So, how long have you been serving the tribal market?
Yes, of the 20 years of ClearScript since we started this, and since it's over 18 years that I've actually been here. Um,
Hmm.
we landed our first tribal nation 16 or 17 years ago. It was maybe 1 or 2 years into when I came here officially, and so the last 16 or 17 years as
Wow.
ClearScript.
Well, we're very grateful. That's what, us here in Nahara, we really want to support organizations that serve our tribal market and are very curious to see how ClearScript can work
Yeah,
with, all the entities that
yeah,
tribes have. So thank you for that.
yeah.
Now,
Well, and Janet, I just wanted to add one thing to that. I'm sorry to
yeah,
interrupt you, but
no, no, no.
um, so much of what we do fits well within the that tribal nation space. So, diabetes obviously is very prevalent, and you see now GLP-1s, Ozempic, you see Wegovy, and some of these that have been created for the weight loss component or weight loss part of GLP-1s. But um, you know, substance abuse, opioid addiction, other challenges. So yes, it does make sense for us to support tribal nations because the members need it. The members, tribal nations have a finite amount of resources, whether it's federal subsidies, whether it's gaming dollars, et cetera. So we need to make sure that the organization is spending as little as possible
Hmm.
so that they can invest those resources into helping their members in other strategies in their respective reservation or location. And so I think that's very important, but it's not all about pharmacy. So we gather backpacks. Some of our teammates at ClearScript love when we get to gather backpacks, fill backpacks up for tribal schools, just based on the fact that I have 3 daughters myself who I probably spoil. I do spoil immensely, and they don't want for much, but
Uh-huh.
they're privileged in that sense, and others aren't that fortunate. So, nothing feels better to me than a school reaching out to me saying, are you interested in putting together a backpack drive? And our team goes out and fills things up from Walmart and Target and pencils and papers, and we have lists, and I'll tell them get every single thing that's on that list. Well, spare
Hmm.
nothing. Scholarship funds. I love that you mentioned that you're offering scholarships. We offer scholarships to our tribal clients and prospects as well, so that not just for those that are working with us, but just tribal organizations where we've put financial scholarships together for members that want to write an essay about what they're doing for their respective tribal nation and how they
Hmm.
want to give back on their own, on their own lands, and we'll help fund that. So it's not just about PBM. That's obviously our
Right.
main focus, but it's about what the other things we can do to help tribal nations be successful.
Oh, we
And
love that,
cool.
Kyle. We love that so much. And how can a tribe uh, view your resources that you have? Do they go onto your website, clearscript.com? And I know that you have the insights page
Yep.
that's there. Is that where we should have our members go to, you know, um, look at all these really cool opportunities that you have to work with
Yeah.
tribes?
Yep. So it's clearscript.org
Dot
because we are.
org. Yeah.
Yep. Clearscript.org. I think we're probably one of one of only one or two PBMs that are owned by nonprofit health systems. So we're a .org. But yes, folks can definitely go to our website, and we'll share what we're doing, resources. They can also, reach out to various folks, like you mentioned, Jill Oldenburg, who's
Mhm.
we use to help us with our marketing. Lynn Branch, who's head of our marketing and communications department within ClearScript, and houses a lot of the resources. But I would say go to the website www.clearscript, singular, not plural, clearscript.org, and look at our website, and then contact us, and we'll get, if it's not on the website, we'll get information to folks that want it about the programs.
That's awesome. Thank you so much. Now let's
You
go
bet.
back to PBM.
Yes.
So, what should our members consider when selecting a PBM partner?
Yeah. Yeah. So I think that one of the biggest myths, if not the biggest myth in pharmacy benefit management, is the myth of bigger is better. And granted, as I said, the big three controls, 80s to, low 90% market share. But whenever you ask about leverage, right, size usually equals leverage. There is this myth that bigger is better. They're the biggest, so they must have the most leverage and they must be the cheapest. But it's all about who does the leverage benefit. And
Hmm.
for the big three, the for-profit publicly traded PBMs, the leverage benefits their shareholders. It never, I mean, and this is an opinion. Um, Maybe others even at ClearScript may or may not disagree with me on this, and others. But I will say, um, if you're going to buy stock, you buy stock in one of those companies because they'll post great returns. But if you're a self-funded employer that has a finite amount of resources and you want to spend as little as possible, still make sure people are healthy and everything's clinically effective, but you need cost effective. I don't think it's just ClearScript, but you have to get away from the big three because the big three are generating profits for their shareholders versus a better mousetrap for their patients, their members, and those self-funded employers. So the tribal nations, Janet, that are part of NAHARA, the HR that representatives that are in NAHARA, they're overseeing, for all intents and purposes, an insurance company. Their plans are self-funded. That means they're paying the bills. The
Hmm.
tribal nation's paying the bills. They might have a TPA and they might have a PBM, but we're just paid by the tribal nation to take funds from one account and pay the claims. And so you need to work with organizations that are using their leverage to benefit and drive down the cost versus benefiting returns for their shareholders. So I think the biggest myth is that bigger is better, because if it's not set up the right way, leverage just benefits the organization. It doesn't benefit the client.
Hmm. This is great. This is wonderful. And what can ClearScript do to help? Other than, is there any other areas that ClearScript can help organizations other than PBMs?
Well, um, one of the it still ties back into pharmacy benefit management, but 340B, that's a very hot topic right now. There's a
Correct.
lot of scrutiny on that program. That program has been around, as I stated in the opening. It's been around since 1992. We've been enrolled as Fairview, as covered entities within 340B since 1992.
Uh-huh.
Um, we support organizations, not just tribal nations, but other organizations that are eligible for 340B, including DISH hospitals and critical access hospitals and Ryan White clinics and
Uh-huh.
black lung clinics, etc. Um, But we operate within the 340B program and live within that space for the last 32 years. And there's a lot, like I said, there's a lot of scrutiny on that program, largely because, of the contract pharmacy arrangements that are in place.
Yeah.
Pharmaceutical manufacturers, I mean, I'll just throw it out there. They don't want organizations to participate in this program because they're not making as much money either. And so,
Mhm.
but that's a big portion of that program. And there's a ton of organizations that have popped up now saying, hey, you should get into 340B. You should optimize 340B. And those organizations have never done it. Those PBMs have never have, it's just because it's something new and something to generate revenue. They're getting into it. 340B program it was set up for organizations that were more disadvantaged financially, for
Mhm.
them to be able to participate, to help spread scarce resources over their membership. In this case, tribal nations help spreading it over their tribal membership.
Mhm.
Um, and when you have PBMs and other organizations that are taking large chunks of that, charging a bunch of money, well, then that dilutes the amount of savings that a tribe can realize, and they can't spread it out over more folks. That it's going against what 340B was initially created to do. And so, yes, it's not technically under the PBM, but it does connect to the PBM. Would be the 340B program.
Okay. And if there were
Yeah.
members that had any questions about a 340B, can they reach out to you,
Yep.
Kyle?
Reach out to me directly. What I
Okay.
would want to know if I were them would be, um, tell me about tell me about 340B. As I stated, I just presented at the Pachanga property
Hmm.
last week, and it was regarding pharmacy. We talked a lot about 340B. So, and one of the attendees in the audience, one of the first question was, can you just explain 340B in as layman terms as possible? Just give me an idea from start to finish. And so I think that's where somebody could reach out to me and say, just explain 340B, what it is, and then explain how that would impact us. What would we have to do to set it up? And
Hmm.
what would we have to do ongoing? And how does ClearScript fit into that equation? But yeah, most definitely, I'll try to make it as simple as possible. And regardless, Janet, regardless what that prospect does, if they go and stay with whomever they're with, or they go to a different provider outside of ClearScript, all I'm trying to do is give them information that
Thank you.
provides them, with a baseline to make informed decisions and find out what fits best for them.
Fantastic. This is great. And thank you so much for all the work that ClearScript does with PBMs on, my career in HR,
Yeah,
pharmacy benefits was the last on our list.
yeah.
And now, with the times, it's really, it's up there.
Probably first on the list. It's probably first now. So, back in the day, there
Yes.
were specialty prescriptions, but there just weren't a lot of them.
Yeah.
Rebates, I remember a day when rebates were like in the dollars, and now
Mhm.
they're in 3,600 per specialty rebate. They're huge, and people that are listening to this might say, what's a rebate? Because there are still organizations that don't get their full rebates coming back from their PBM or whomever they're using. It's still
Right.
hidden resource streams. But to your point, back in the day, pharmacy
Mhm.
was an afterthought.
Yeah.
Copays were $2 and $4. Drugs represented less than 10% of the healthcare dollar. There really weren't specialty patients. Now there are specialty patients using specialty meds. It's
Right.
probably, a quarter, approaching a third in pharmacy, but specialty is driving about 56% of that 25 or the third. About 56% of that is specialty, and that's being
Wow.
driven by a little over 2% of the people. So
Excellent.
low utilization in terms of number of scripts and number of patients, but high cost based on the fact that they're in that specialty category.
Wonderful. Well, wonderful. I really enjoyed our time that you
Yeah.
spent with us today.
Yes.
And we are going to see you at our 28th annual conference in
I'm
September
excited.
at Choctaw Resorts and Casinos. So,
Yes.
for those who are going to be attending our annual conference in Durant, Oklahoma this September 2024, stop by ClearScript, meet Kyle in person, learn about PBM. What can your organization do with PBM? It's really important. And we are going to be sharing Kyle's information for those that want to reach out and ask Kyle some questions. That's what he's here for, to really educate and answer questions for our members. Kyle, thank you once again for
You're
meeting with
welcome.
me today. And thank you for all you do with ClearScript.
Well, I want to just say thank you as well, Janet. And I mean, I said this at Pachanga and I'll say it again. I appreciate, people that are listening to this and also other organizations that are making it a concerted effort to help Native American tribal populations. So competitors of mine, whether it's brokers and consultants or TPAs or other PBMs, those organizations that are really putting an effort into helping this niche market. I really appreciate everything that everyone's doing, and that what you're doing as well, Janet and Nahara, in bringing information to a very special market that I love serving. So thank you.
No, thank you so much.